Good.
Hello, this is Ken Sparks. I'm President and CEO of Children's Hope Chest and our initiative known as Greater Calling. We're really glad to be here with you. I'm with Milkias Tai Gutama. He is our country director in Ethiopia. And I thought it would be an opportunity to reflect a little bit about what Mickey and I experienced last week in Ethiopia while I was there about the impact of emotional health and wellness. Mickey, I'm curious, would you share with our audience why mental health is so important to the holistic development of a community?
Thank you for the opportunity, Kane. As you all know, the holistic community development starts by helping the community to change their paradigm and perception of development. So that in order to do that, we need to work on their mental health, so that they need to have a stable mental, so that they can understand well, so that they can start, be part of the holistic development aspect of our intervention.
Yeah, that's very true. It's so important that you start with a healthy baseline to then help change paradigms. Yeah. So what is the mental health need in Ethiopia?
It's been a very great challenge that we, for the last many years, but for the last 4 years, because most of our people are facing challenge, especially challenge related to political conflict, ethnic and tribal conflict. In some aspects, it's a religious conflict also there. And then COVID happened starting from January 2020, and our economic inflation was very bad for the last 4 consecutive years. So that these all things really contributed for mental health issue here in Ethiopia. So on the recent studies, more than 30 million people here in Ethiopia are prevalent to mental health issues. So that the need is very, very huge. Yeah.
Mickey, maybe you can explain a little bit, because I know a little bit about the situation there, relative to the number of professionals, emotional health and wellness counselors or professionals. What does that landscape look like in Ethiopia?
Even though we heard that some counseling professionals are graduate from some universities here in Ethiopia, but finding the counseling service, even in our capital city of Addis, is very, very, very challenging. So that we can say that it's very scarce. So that if you go to communities that we are serving, definitely you can't find even one counselor to give a mental health service for our communities that we are serving.
Yeah, it's a very challenging situation. So that leads me to my final question, and that is, what kind of impact could emotional health and wellness training of our staff and then implementation in the community have at the care point level? What might that impact be?
Yeah, but we've been involving in this issue for the last 2 years, so that we gave a startup training for our social workers. Most of our staff are social workers and nurses. They already have some basic education about counseling while they are in their colleges and universities, but we just gave them how to practice those aspects of counseling techniques to the day-to-day activity of in our care point. But still, we just want to make them, to increase their professional capacity in order to give a quality service for our communities that we are serving, but also to expand that one to the whole communities that we are involving in. So giving them training is very important, but at the same time, giving this opportunity for the whole community that we are serving is a big deal. So that's the aim that we have.
Excellent, excellent. Well, I would like to invite everybody who's had a chance to hear this brief interview to join in with Greater Calling to be making an impact in global emotional health and awareness. Your financial support helps Mickey and his team increase their capacity to then impart emotional health and wellness to the children and the families that we're serving in these highly impoverished areas of Ethiopia. So we hope that you'll join with us. And thanks again, Mickey, for taking some time this evening there in Ethiopia to be able to chat and help people understand. And it was good to see you again last week in person. That was awesome.
The pleasure is mine, sir.
All right.
Thank
We'll
you,
see you
man.
later. Thank you.
Ciao.